All right, today my partner Ian and I are going to do a blood transfusion demonstration. There are different types of bloods that can be transfused. Today we're going to hypothetically use packed red blood cells to raise this particular patient's hematocrit level and hemoglobin. Um, so we've already gotten his consent form. We've checked the physician's orders. We've started 2 IVs, one in each arm. And once we get the blood from the blood bank, my partner and I will check and verify the patient's name, the blood type, the unit number on the blood bag, and just make sure everything's according to the blood bank form. Um, we'll go ahead and set up the administration set. For this particular demonstration, um, we will use this normal saline bag as the blood bag. So first, we will spike the normal saline bag. And we'll make sure the tube is clamped on the side that the blood will go into. We'll prime the remaining tube with the normal saline and make sure the drip chamber is full halfway. Then we will spike the blood bag and prime that tubing down to the blood filter. Before we'll check the patient's vital signs before we start the administration. And all of this procedure, the blood transfusion itself must be done within 30 minutes after we receive the blood from the blood bank, or it has to be returned. We will go ahead and hook up the tubing to the IV and let it run to the prescribed drip that is ordered per the physician's orders. And we'll sit by the patient and for the first 5 minutes, looking for any signs of uh, reactions, backache, shortness of breath, chills, or itching. There are different types of transfusion reactions. There will be acute hemolytic reactions, which show up as fever, chills, and shortness of breath. Febrile reaction, which would uh, show as a temperature increase from the baseline temperature that we've gotten from the vital signs, or an allergic reaction, or anaphylaxis, which would show up as hypotension, loss of consciousness, and anaphylactic shock. Now, if there was a transfusion reaction, we would immediately stop the transfusion, clamp the IV, clamp the tubing, and disconnect the tubing from the IV itself. Now, we'll flush the tubing with a new flush. Clamp that off. And we will check the patient's vital signs. We'll have somebody notify the physician and let him know that the blood has been stopped and the patient is being assessed. Now we'll take the blood bank, the blood administration set and place it into the biohazard bag, label it, and we'll send that to the lab. As far as the patient, we'll continue to monitor him, and we'll also need a new blood sample from him. Now, we would need to take that from the opposite arm. So if you did not have an IV started, you would use your butterfly needle and tubing and tubes, and then send those to the lab as well. And you'll maintain continue to assess the patient, and there you have it.
And two concepts and/or nursing diagnoses for this would be risk for impaired gas exchange because of lack of hemoglobin in the blood. So two concepts would be perfusion and gas exchange.